Simon.
That's all good. Okay.
It worked really well.
We're live.
Just one more time.
We're live.
Take two.
Hello, I'm Richard and I'm the Chief Executive at Sherwood, and I'm going to start with an apology. We are starting 8 minutes late, and you won't believe this, despite all of the practice and preparation we've put into this. We've just been speaking at the camera for the last 8 minutes, and we hadn't realised that we'd press the record button and would open ourselves up to the audience. So very sorry for starting late, and in a moment we'll go back through the points that we've already made. But I'm Richard, I'm the Chief Exec here at Sherwood. Other people in the room?
I'm Julie Hogg, I'm Chief Nurse here.
Hello, good evening. I'm David Sowen. I'm the Medical Director.
Hi, I'm off camera. I'm Robin Smith. I'm the Acting Head of Communications.
And we also have Simon Barton, our Chief Operating Officer, joining us, although he's not in the room. We will bring him in. Thank you for joining us tonight. The aim of tonight is to answer your questions and to hear from you. Please ask us any question that you would like. We've had some questions in advance that we will respond to, and ask those questions as we go through the next 40 or so minutes. Anything can be asked. We will answer the questions. If we don't have an answer, we will come back to you. The only thing that we would ask you not to pick up on, for obvious reasons, is specific details about your care or about the care of your family or your friends. We're not able to go into patient-specific information, but for example, if you say, I'm waiting for an orthopaedic appointment, how do I find out about it? Has orthopaedics restarted? That certainly would be a question that we would be keen to answer. The structure for the day is we're just going to reflect slightly on where we are as an organisation. We're then going to pick up on some of the changes that we've put in place to make sure that we are keeping you safe when you come into the hospital for your appointment. We're going to touch on visiting and the changes that we've put in place around that, both at Newark, Mansfield Community Hospital and at Kingsmill. And we're also going to update on the recovery and the restoration of our services. That's the structure. Ask us questions about that, ask us questions about anything else. Before we go into the structure, I just wanted to thank you, you individually and you collectively. Clearly, COVID over the last 6 months or so has had an unbelievable impact on us, both in terms of an impact about our personal lives. So we haven't seen friends and family for long periods of time. We know that it's had an impact on people working, whether people have been furloughed or made redundant, people have been caring for their children who may have been at school, etc. And certainly its impact on our working lives. At Sherwood, we set out over the last couple of years to achieve a couple of things. One of the things was about putting patients at the centre of our decision making to make sure that our care is as safe, is as high quality, as good as it can be. And the other bit underpinning that is making sure that we have a culture where people feel supported and included. That was our intention prior to COVID, and certainly those ambitions have continued throughout COVID, and we feel that, broadly speaking, we've been able to do that, and we've been able to do it with your support. Not only with your support for clapping on a Thursday evening and supporting the wider public services, for your support by many of the local businesses around us, Morrison's and many other, providing outstanding support to NHS colleagues and colleagues across the public sector, but also for your support for recognising that it has been incredibly difficult over the last 6 months. And as hard as we have tried, we've had to postpone appointments, we've had to cancel appointments, we've had to change our visiting rights. We've asked a lot of you when you do come into hospital to socially distance, to wear masks, to wash your hands, etc. So I think we should take huge pride in what we have collectively achieved, both in terms of Sherwood, the wider NHS, the public services, the support of patients, the public, the wider community across Nottinghamshire. We should take pride in that, but we should also reflect on quite how difficult it has been. And the reality will be that the coming months as we move into winter are likely to be difficult too. I think that's enough from me. Julie, anything you'd like to add to that?
I think the one thing I say is I joined Sherwood just before all of this started in December. So I was very new to the team when COVID hit us. And I've been really overwhelmed by how well the staff have worked together, turning around, changing wards, with half a day's notice, really working together to do the right thing for patients. I was also quite overwhelmed by the amount of PPE we had donated when there was lots of talk about there not being enough PPE in hospitals, and the support that we had in terms of meals for staff, and just the way that the community around us has followed the guidance. So we were lucky hear that we're able to manage it really well, I think, and part of that is because we had a supportive community around us that followed the guidance.
And just before Dave, PPE is personal protective equipment, which you obviously would have probably heard about in the media. Dave, as the medical director, anything you want to reflect on?
So I guess my reflections would be, and you'll have heard the word bandied around a lot, and that's unprecedented, and it certainly has felt that way. And it's felt that way for us individually as members of the executive team, but primarily for our patients, the way we've had to change our services, as Julie was sort of alluding to, the way it's been unprecedented for our staff, and you touched on some of that. That's within their working practices, but actually their home lives as well, and going through to that. And then also as us as a what we like to call an anchor organisation of a very substantial employer in the town, an organisation that has a big reach out into the various aspects of the community and wider across into the healthcare organisation across the whole of Nottinghamshire. And as you say, the support we have had has been fantastic. The understanding of our patients has been fantastic. But I think part of today is just to try and get that message back out to our patients and publics that actually we're open for business now, and actually we haven't come through all of this COVID crisis, but what we've got to start to adjust to is living and working with COVID as part of our normal business.
Fantastic, thank you. So I'm sure that people are asking questions. Please put questions into the chat room, and we will respond to them in the structure that we've described. Is it possible, Robin, to pull up the slide? I'm going to touch on how we're going to keep you safe and how we are keeping you safe at the moment. Oh, can I see it? Is it possible for us to see it or not?
No.
No, it's going to be from memory. Obviously, as Julian and Dave and I were touching on, this is about us working together to make sure that we are open for business today, and to ensure that we remain open for business as we move into winter. Winter during normal times is incredibly difficult, and is certainly going to be more difficult this year. When we talk about being open for business, ultimately what we mean is, whether it's at Newark Hospital, Mansfield Community or Kingsmill, it means that if you need to be in a hospital setting, we want you to be in a hospital setting, and we will do everything that we can do to keep you safe. Some of the steps that we've been taking over the last couple of months at Sherwood to keep you safe, and we need your help to make sure that consistently we all behave in line with this, because I think this really is about individual responsibility, is to make sure that if you come on site, you maintain social distancing. We know about social distancing now wider in the community. It is certainly applicable in a hospital setting. We ask you to come in wearing a face mask. If you haven't got a face mask, we will provide you one upon entry. We ask you to make sure that you are washing your hands regularly. And to be clear, all of these points not only apply to a hospital setting, but certainly will be applicable for reasons that you would understand in terms of our personal lives outside of a hospital. It's also about treating each other with respect, not only continuing to respect your families, your friends, the people outside work, but recognising that at Sherwood you have 5,500 people, healthcare professionals, clinical staff, non-clinical staff, who are working together ultimately to serve you. We are all working under pressure and stress. I say regularly, we can never say for certainty what's going on else in someone else's mind, but please make sure that you treat colleagues here with dignity and respect, and we certainly will do our best to ensure that we treat you with dignity and respect. We will not, let's be clear, we will not always get things right, but it's not through want of trying. And if we do make mistakes, please raise them with us, but raise them in a way which is in line with the common values that we all hold dear. Julie, anything you want to add to that? Or Dave?
I think probably the only thing is to mention visiting at this point. So when we were in the peak of the pandemic, there was very clear guidance nationally that no visiting was permitted outside of compassionate grounds where the patient is end of life. We're now operating at Kingsmill and Mansfield Community Hospital a designated visiting policy. So that means that each patient can have a designated visitor on a daily basis for 1 hour. The hour is set because we need to maintain social distancing and reduce footfall in the lifts, etc. So that is in place at Kingsmill Hospital and at Mansfield Community. At Newark, we're just monitoring the situation in the community there. So there has been an outbreak in some local food factories. So we have gone back to the compassionate visiting policy over there. And the reason for that is because patients in hospitals are much more vulnerable than anybody you'd meet when you interact in the supermarket or in a pub, perhaps. So it's important that we don't bring in COVID from the community. So at the moment, those restrictions remain in place at Newark, and we'll be reviewing them again on Friday, and we'll put further communications out on Friday to state whether they will continue or whether we will go back to the designated visiting policy. I guess the other bit to say is there are some areas in our hospital where we can't maintain the 2 metre social distancing, and those areas are areas such as the accident and emergency department and outpatients. So we're asking patients attending those areas to come on their own unless they require a carer, a parent, or the patient has significant cognitive impairment, learning disabilities, dementia, something that means that they really need somebody with them to support their care. And we're asking you to do this to keep everybody safe, and we're doing our best to get things back to normal as quickly as we can.
And I guess the only thing I build on that is your last point, getting things back to normal. So in the similar way across all NHS organisations, we stopped a huge amount of services. I think we stopped around 50 different services during the peak of this outbreak, and we've now brought back all of those services, and we're trying to get them back to maximum activity. I don't think we're there yet. Well, I know we're not there yet. And some of that relates to Julie's points about we're having to work through the logistics of how to make it as safe as we possibly can.
Any questions linked into changes to keep people safe or visiting that we want to pick up on, Robin?
Yeah, I think we've addressed some of them, but some are worth repeating. An anonymous person has asked, when attending a clinic, are people allowed to come with the patient?
So we ask that patients come on their own unless they require a carer, unless they have difficulty understanding what the doctor or nurse or healthcare professional is telling them, or if they are on a cancer pathway and receiving news. So for most people, it would mean they should come on their own.
We've also had a question from a member of the public interested in health matters and wishing to support Sherwood Forest, asking what the most important behaviours are that they can do themselves. I'm assuming that's to protect themselves and the community at large.
So I think it's everything that Richard mentioned at the beginning of this. So this is around ensuring that you maintain social distancing, that you wash your hands regularly, that you are following the current government guidelines in terms of when you are out and about, and those guidelines are changing fairly regularly, so keeping abreast of what's happening, and then you're using face coverings in line with what's been set out by the government, and certainly face coverings when you come into hospital. I think the other bit is about lifestyle. So I think naturally lockdown has made people less active because we were asked not to get out and about, and I think one of the things I would encourage you to make sure that you're doing is that you are active and that you are returning to your normal exercise habits or walking habits that you were before lockdown, and looking after yourself from that perspective. And
we're certainly encouraging anyone who's waiting for an operation to put that time to good value, to maximise the things that you can do in effect. So actually making that choice and giving up cigarettes for that period of time will have a significant impact, even if it's for a number of weeks, on your recovery from the operation. Losing that little bit of weight, ensuring that your sugar diabetes or your medication is under control, all of those aspects, and being perhaps more active than you normally are will actually benefit you.
In a way, Dave, that links into another question we've been asked in advance. Around patients that have got pre-existing conditions and perhaps not had the treatment that they might have done, and It's an opinion really. They're asking if those patients are healthier or less healthy by the restrictions that have been imposed on services.
And I guess it's a bit difficult to answer that in a general term, and I think there'll be a sort of a mixture across that. I think the key bit is for that this has been an opportunity for us. It's been a terrible time for many of us, but it's also been an opportunity for us to consider actually what is our health style, what can we do, as Julie was saying, can we actually think about our activity levels and improving our fitness, notwithstanding that many of us have been confined to our homes, but and then about what things can we actually adjust in terms of our alcohol intake, for example, or in terms of our smoking habits.
I want to just share a personal anecdote, tying back to something that Julia was talking on there about the response to what can we all do here. About 3 weeks ago, it's my daughter's 4th birthday, and inevitably, like lots of us, we massively scaled back our expectations for a party, but we did have a socially distanced gathering with one other family in our garden, certainly in line with all of the government guidelines. We took it very seriously. It was on a Sunday, and then on the following Thursday, the family contacted us, and 2 of the 3 members of the family had tested positive for COVID. So we had to go into isolation for the 2 weeks as expected, and it really made me think about, as someone who works in a hospital and has been facing this situation for the last 6 months, it really made me think about COVID is still out there, and we're all human, and we know that when we get tired, sometimes we can let our guard down, or we sort of stop doing the things that we've been consistently doing. And it's really sort of, if I needed it, it's reinvigorated my thoughts about the importance of regularly washing hands, making sure that we're maintaining social distancing, wearing the mask in every suitable environment, not gathering in large groups, etc., etc. And for me, that ties back to the bit about personal responsibility. We can all take decisions about the impact that this may have on our personal lives, but if we were to be COVID positive, and then I interact with colleagues at work, ultimately I'm putting their lives at risk, and then therefore I'll be putting patients' lives at risk as well, because we won't be able to bring back the services that we've brought back. It's really just a plea, if we need it, about trying to do everything possible to ensure that we are continuing to behave in line with the guidelines, because they've been put in place for very sensible reasons.
Thank you. Related to the sort of visiting, we've had a couple of questions on some specifics. So Sylvia has asked, she mentions her sister's got hearing difficulties and she likes her to attend with her to assist in that. And another individual has asked about people who may want to come for cultural reasons. What would your advice be to those?
So I think it's worth a conversation with the relevant department or ward leader in that area. I think did you say Sylvia, who has a sister that's yes, hard of hearing? I think because we're all in masks, it makes it very difficult, and so we'd absolutely support that. I think for cultural and religious reasons, I think it's worth a conversation with whoever the departmental leader is, to just make sure that we are doing everything we can to support that individual. And
we work with our various local charities and national charities, for example, people who are hard of hearing or deaf, and those sort of aspects. And actually, what else can we do in terms of masks? And we can use visors that will hopefully allow people to read in a more helpful way.
There's another question specifically about A&E, asking what to expect when you attend A&E. Are areas for coronavirus patients to go to specifically, and other patients go to separate areas?
Yeah, so the emergency department are separated out, so they're separated into people we suspect have got coronavirus and those that we think don't have. So they are separated out, but there's a lot less room in A&E at the moment because of the 2 separate pathways, and that's why we're asking that people do come on their own where they can.
And one more before we move on, if I may. Anonymous individual has said, I've been told my consultant will call me, and they're asking, will this be a video call or a phone call? Would we know that?
It could be either, if we're honest, it could be either. I'd suggest contacting the secretary for the consultant find out, but should receive details of that video call if that's the plan.
We're trying to do more and more of our patient contact with video calling, because that gives us a better, more realistic contact, but it's not always possible.
I think one of the things, and thank you for the questions, please keep asking. I think one of the things we can do after this tomorrow is the way in which we've communicated that we were doing the Q&A tonight for the different communication methodologies. I think we can also use that to communicate tomorrow, sort of the list of email addresses or phone numbers generically. So if it's on a Macmillan cancer pathway or an outpatient appointment, we can remind people about the best way of contacting the organisation with those specific questions.
Absolutely. We've got plenty more questions coming through if you want to.
Yeah, let's keep going.
Absolutely. Malcolm has asked, how long do you think it will be before face-to-face consultations start again?
To be honest with you, I think that's a bit of an uncertainty at the moment. I think, being realistic about this, I think our outpatient services will never go back to the way they were. I think a number of our consultations will now, going forward, always be video consultations. I think initial consultations are more likely to be face-to-face, recognising that that will necessitate the personal protective equipment. But I think increasingly more and more of our consultations will be using technology and not face-to-face.
If we might start, there's a number of questions around sort of procedures. Dave, I think perhaps you might be best placed to answer certainly some of them. Another one said, I've been on the surgery waiting list during the pandemic. When will I know if my surgery is going to happen?
So we're in the process of trying to contact all of our patients. We're going through all of our surgical lists, and this is a national process that's going through. What we've been trying to do in terms of Sherwood is we've been trying to go through, all the specialties are going through all of their waiting lists to try and identify whether there's patients that need increased prioritisation, or there are patients who have deteriorated, or all of those aspects. So I would anticipate that we'll be contacting the majority of our patients over the next few weeks.
Can I just add something to that? So as Dave explaining, and if you pick up the newspaper or read the internet, you'll be aware that the waiting list, so the number of patients waiting for appointments, be it an outpatient appointment or surgery or diagnostics, across the national NHS has grown immensely over the last 6 months, for reasons that we understand. We've had to focus on COVID, and therefore our ability to provide appointments has reduced. What we have been doing, working with GPs and commissioners and other colleagues across NHS, is we have been prioritising the patients whose appointments are most important. And there's at least 3 criteria there. You've got patients on cancer pathways, you've got patients with suspected cancer, you have patients who've been waiting a very long time, and you've got patients who are sort of clinically urgent or emergencies. Like many organisations, a real focus for us has been the cancer pathway. And to provide you a bit of a context about the work that colleagues at Sherwood have put in place over the last couple of months, I was looking at some information yesterday. There are 21 hospital trusts across the Midlands, East and West Midlands, 21, and the people at Sherwood who are serving you have reduced the numbers of patients waiting for an appointment by the greatest amount of those 21 hospitals over the last 3 months or so. So the reason I reference that is to assure you that we are doing everything we can do to bring appointments back. But the reality is, as Dave was explaining, is it will take us a long time to get back to the timeliness of care that is really important to us and important to you.
Thank you. There's a specific one, if we're able to, that came through in advance around orthopaedics, asking if we're doing any orthopaedic operations yet, or if not, how soon we're doing that.
So orthopaedics was one of the services that we brought back, and we are doing orthopaedic operations, and our aim would be to increase our orthopaedic capacity. We've got some plans to strengthen our orthopaedic operating on our Newark campus, on our Newark site, and that's coming in. I think it's starting in September this year, so that would significantly help. Orthopaedics is back and happening. Thank you.
There's a question around Newark, the urgent care centre, asking when that's likely to be back at 24 hours.
Thanks for that. So we have reduced the opening hours of the Newark Urgent Care Centre during COVID, and quite simply, the reason for doing that was because we had to, because we knew that the rates of COVID patients were increasing, and we've seen over the last 6 months or so, we've seen colleagues have to, who had COVID themselves or had COVID-like symptoms or had to shield. We didn't have the levels of clinical people in the organisation to run all of the services that we would like to be running. So we had to redeploy people into different environments. One of the redeployments that took place was the overnight closure of the urgent care centre, and those colleagues in particular would have been redeployed into intensive care here and into the emergency department at Kings Mill. That decision was taken by senior clinical leaders, so as the chief exec I fully support it. I own the responsibility for that, but please don't think it was simply a management decision. It was taken by clinicians because it was felt to be, for patients, the safest thing to do. It's not a decision that we took lightly, and I'm acutely aware of the concerns about does this mean a change in the services at Newark forever? Does this mean that we're never going to restart the urgent care centre overnight forever? I can sort of look at you down the camera as much as I can and give you assurance that is not our intention. You have my promise that at the appropriate time we will revisit this decision, and working with colleagues we will do everything possible to reopen the urgent care centre 24 hours a day. Just some of the context around it is we know that very few patients prior to COVID were attending the urgent care centre overnight, so very few patients have been affected by this. Obviously our real concern would be whether patients have come to harm as a result of this. The clinical colleagues working in Sherwood, working with primary care, are clear harm has not resulted, has not occurred as a result of this. And the other bit is, if you look at the wider Newark provision over the last 3 years, we can provide absolute objective information that shows that the services available at Newark have grown. Patients who previously would have to go to QMC in Nottingham for appointments or over to Kingsmill for appointments, invariably now, if you've got a Newark postcode or you live in the wider vicinity, we are able to provide your appointment at Newark. So to conclude, it's not a decision we took lightly. It was based around the clinical evidence. It's a decision I support. It will continue for now, but at the appropriate time, we will reopen that service overnight.
We've got some more sort of general questions. Ian has asked around flu coming into winter, reflecting that many GPs are working virtually, and asking how is the flu jab programme going to work this year?
Do you want me to start with that one? So we're all committed, not just here at Sherwood, but actually across the whole of the healthcare community in Nottingham, and having a really significant flu vaccine campaign this year. The reasons that have been alluded to, but it's absolutely key that we ensure as many people as we possibly can get vaccinated for that. And you'll have seen the guidance on that has changed this year, and we're working through the logistics of that. In terms of Sherwood, we have already started to communicate our flu plan to ensure that that all of our staff are vaccinated, and all of our at-risk patients who are actually with us as inpatients are or will be vaccinated, and we're working with our GPs to ensure that they undertake their vaccination programs as well. And so I think the availability of the flu vaccine program will be enhanced rather than reduced this year.
Thank you. Julie Tasker has emailed in. She's asked, how can we integrate people accessing complementary therapies to support their health awareness and maintenance?
Is that one for you or for me?
Probably a bit of both, isn't it? It's probably a bit of both.
Who's going to start?
So I think we already have some. So lots of hospitals have volunteers who offer complementary therapies. And the other bit is along the cancer pathway, which are two key areas where I would say we're beginning to do some work around this.
Yes, I think healthcare is changing and people are getting more savvy about the complementary pathways to what we traditionally have provided. I think as an organisation, Sherwood has strengthened our links with our GPs and our local practices to enhance that and to make sure that's more of a joined up process. And so aspects in terms of social prescribing, in terms of actually being able to access gyms, for example, notwithstanding that they've only recently opened, in terms of helping exercise for people who are preparing for operations, for example. We've started to develop all of those, and that is work that we're building on, and we're also very keen to develop. We've got very mature programs such as anti-smoking programs based at Sherwood and across the community, and again alcohol liaison services. So I think this is a really important part, health prevention, if you like, and helping people to take some ownership for their own outcomes and their own health is a key component of where we need to develop our services going forward. Really good question, thank you.
And I think within our maternity service, we have a number of midwives who are qualified in complementary therapies such as reflexology, aromatherapy, and hypnobirthing to support women during labour and antenatally.
Okay, thank you. We talked a bit about cancer. We've had a question that's come through about specific care, so I don't think we can probably answer that, but we might help signpost this individual. It came through an email, so we will respond to you directly as well. This individual's husband has cancer and was due a 6-month checkup in July. He was looking for some advice about when he might be seen. It's never been clear enough for a 12-month checkup, so sort of worried.
So if we've got that email, we'll make sure that the team actually address that in person. But this is part of the ensuring that all of our patients who are waiting are undergoing scrutiny, and we're checking up on them.
Thank you very much. There's a couple of questions come through around sort of people experiencing post-COVID problems, and asking really what if we've got any plans around treating those, referencing fatigue, sort of 3 months down the line. I don't know if you've got any reflections on that.
So we're learning more about this disease every day, every week, and unanticipated aspects of the disease have been around the fact that we're seeing more blood clots in people who have COVID. So the blood bit seems to become stickier, and so that was a surprise to us, and we're having to deal with that and develop strategies for that. And then the post-COVID fatigue, and that lasts a number of weeks, often months, and what that means for people and how they're going to get that help across the community. Again, we're working with our community partners with that and the rehabilitation that people need. It's going to be a developing concern the longer this goes on. Thank you.
Slight change of track. We've been asked about money. The anonymous question said, there has been discussion in recent days about finances being linked to recovery performance, e.g. the reduction of waiting lists across the system. How ready are we to work in this way? Great
question. I'm wondering whether Simon, our Chief Operating Officer, has asked me that question. So actually, we, the executive team, the senior leadership team in the organisation meet on a Wednesday afternoon. So we met this afternoon earlier today, and that was one of the things that we discussed. From my perspective, we need to continue to do the right thing. And the right thing is focusing on the best care we can do to patients, focusing on the welfare and the well-being of people who work in this organisation, whether it is the people we see walking around with the Sherwood badge, the volunteers, MediRest, Skanska, all of the other people who support us to provide safe care to our patients. And I personally feel that if we can do that effectively, the money will take care of itself. We're an organisation that for the last 4 years has delivered on our financial agreement. Clearly, if you look at the wider economy and you see what's happening in the country, I think money is going to become increasingly or even more scarce in the future. But I want to provide you assurance that we're an organisation that will continue to focus on the best care to patients, to continue to focus on the welfare and the well-being of colleagues I've described. And I think by doing that and working with our regulators, the people who sort of govern what we do, we can set a plan that finds that right balance between ambition for this winter, but also pragmatism. As an organisation, we deliver invariably what we say we will deliver. And by doing that, I think we'll be okay from a financial perspective.
Thank you. We're approaching the end of our scheduled time, but we started a bit late, so we're okay to do a couple more questions. Thank you. Actually, not a question, a comment has come through from John. I wanted to repeat it. It's not a question, but a thank you to the dedicated unit. He attended 2 weeks ago and received excellent care by very professional caring staff. Thanks, John, for contributing.
Thank you. We'll share that with the team.
Slight different track, David, from May. We had a question about around sort of what's it about death rates, specifically the death rates of patients assigned to different specialities and comparing that to previous years. Is that anything you can talk around that?
So in terms of the number of patients who sadly passed away as a result of COVID, we obviously have that data, and that's part of the data we're supplying to the national figures. We've had to date, we've had 124 patients who sadly passed away. When we look at death rates, and we've looked through those deaths to ensure that the care that they've received is appropriate and those sorts of aspects. In terms of the death rates across the whole year, we capture that. We have about 1,500 deaths a year or so. I think last year it was just slightly over that, 1,538. In terms of what the impact of COVID is going to be on that annual death rate, I don't think we know as yet. We know that we've seen an excess number of deaths for the period of time that we've been through, but what transpires over the rest of the year, I think we have to wait to see, and that's the same as being reflected nationally. In terms of individual specialties, because the COVID deaths come in with the difficulty breathing, the majority of deaths that we've seen have been excess deaths we've seen have been related to respiratory disease. I think that answers that question.
I think so, yeah. An interesting one before we finish. Julie, probably for you around NICU. Someone's question. So my child's NICU nurse has said that they've had a fall in the amount of babies admitted since coronavirus started. And they're curious about what sort of might have caused the decline in admissions. Could more rest at home while pregnant have been a factor? Or any other thoughts that you might have?
The team have been working on a care bundle that prevents admissions to the NICU. So that's around keeping term babies warm and some measures antenatally. So I think if you were to ask the team, they'd say it's around their consistent application of this care bundle. But I think you're right, as time evolves, we'll need to see what's gone on elsewhere.
It's quite an interesting and thoughtful question,
I'll apologise, our light is on a timer in this room and it's gone out as we talk, so
I'll step up.
Slightly dark in the picture, that's why. We're just approaching the end of our session, I think. I'm just going to quick flick through whether they're not addressed. If any more questions come through to us, our communications address was in the communications we sent out, so we're both more than happy to answer those specifically or to point you in the right direction. I think what we should do now is just have our sort of any concluding remarks or anything we'd like to So I'll ask the people watching to do.
Julie.
Not for me. I think I've asked lots of you already, but just to say thank you for spending some time with us this evening.
Thank you.
Yeah, very similar. Thank you all for your patience to bear with us and helping us through this. Thank you to all of our staff who've been absolutely fantastic during this crisis, and reiterate the message that we sent earlier, that if you are in any way concerned, ill, or all of those aspects, and we are here to help you.
I think you want to say, Robin?
No, well, I think from a communications point of view, we've asked a lot from the community. It's kind of where we started at the start, to say thank you, but we've asked them to do many things in different ways and asked us to support us, and I think it's been an absolutely fantastic response from the community, and the engagement we've seen through our social media channels when we've asked people to do things unusual or that aren't difficult. It's been great. But thank you to that. Thank you to everyone that's put forward very kind donations that I know our sort of charitable team were inundated at one point in terms of donations, both of sort of time and products and things like that, and it's massively appreciated. So yeah, that was all I'd say.
Cool. Well, thank you all so much for taking the time to join us and to ask the questions. Hopefully you feel that we've been able to answer the majority of them. As we've reflected on, there's some that have got some specifics that we will certainly respond to tomorrow, in particular the question from the patient whose husband has bladder cancer. We will find the detail and we will contact you tomorrow about that. I was just listening to colleagues and reflecting that like many things in life, the provision of high quality of care to patients ultimately is about teamwork, and during COVID, quite rightly, the focus has been on NHS staff. In particular, we can think about people who work in intensive care or in the respiratory wards or in the emergency department or the urgent care centre at a Newark hospital, but we're really clear that when you focus on Sherwood, Mansfield Community Hospital, Newark, Kingsmill Hospital, it's about all colleagues coming together. So my first bit is a thank you to the 5,500 colleagues at Sherwood, whether you've been wearing full PPE for 6 months or whether you've been one of the colleagues that we've asked to work from home. You've all contributed immensely. I'd like to extend those thanks to thank the volunteers and the governors who work at Sherwood and support us. We have in excess of 600 volunteers. We have many governors. We have many members of the organisation, and the big things you've done for us, the small things you've done for us have made a huge difference. But ultimately, this was an opportunity to thank patients, to thank the public, to thank the community for what has been a huge amount of support over the last 6 months, and the things that have gone well have been because of the teamwork involved. We're grateful for the support of the local authorities. We're grateful for support from our GPs, from commissioning partners. Hospital care has joined up, so patients who come into Kingsmill to Newark sometimes will find themselves at QMC in Nottingham or City Hospital, and we'd like to thank Nottingham University Hospital, who work very closely with Nottinghamshire Healthcare Trust, who provide community and mental health services to us. So it really is a team effort. Despite the challenges that we have faced over the last 6 months, we are proud of what we've achieved with your support. I hope you feel proud of the hospitals that you now have in Mansfield, in Sutton and Ashfield, and at Newark. I was talking to somebody yesterday. When you move to a new location, if you have children, one of the things the estate agent will say to you is, "Oh, you're moving to a place with a great local school," and actually, I think increasingly people are reflecting on they've got great hospitals around us. And that's something we should all feel proud of. But we do know, as we've reflected on, that the coming months and certainly this winter will be difficult. I'm confident that we can get through it. It will be tough, but I'm confident that we can get through it, and we'll get through it by supporting each other, by looking after each other, by being kind to people. And please make sure that you're kind to yourself. And I'll conclude with what Dave just said, our medical director. Our hospitals are open. We will provide you with safe care. If you need to be in a hospital, we can provide you with care, but we need you to think very carefully about, do you need to come in for an emergency appointment? Is it really an accident or emergency? And secondly, are you doing everything that you can do in your personal life to make sure that you're keeping yourself safe to keep your friends and family safe, and ultimately to keep the people in the hospital safe as well. So thank you so much. I'm sorry that we've overrun. If you think this has been of use, let us know. If you think it's been a complete waste of time, let us know. And depending on the feedback, we may well continue with these as we move into the next couple of months. So thank you, and I wish you a very safe evening.